when I was in seminary. So I was at Duke Divinity School during 3 years of seminary training, and I did my first internship there with an urban setting at a women's homeless shelter. I think the hardest thing I saw was my second round of chaplaincy was in Dallas, and I worked at a large community hospital and dealt with we serviced the prison, and we worked with the homeless population as well. And I think the hardest thing I saw was ministering to some of the inmates who came in with with terminal illnesses, and they just came in on board with all of their grief and regret for the crimes they'd committed. Kind of, where is God in all of this, in the midst of suffering? Like a pastor to the hospital. I was a pastor not only to the patients, but to the nurses, to the doctors sometimes, because they grieve too when they lose people. Not so much. No, not so much, because the patients really came first in that scenario. I mean, doctors, that was fewer and far between when you had to minister to doctors. They usually kind of played it as if they had everything taken care of. How long to sustain life, and sort of how long to keep people in ICUs, on machines, when there's no hope of life. Yeah, I definitely wanted them to come to their own answer. There was one time there was a guy who was contemplating. He wanted to discontinue treatment because he just wanted to die. He was tired, and so I gave him the space to talk about that, and he ended up deciding that he wanted to continue treatment. But if I had told him not to, he may have reacted differently. So I'd like to give people a chance to make their own decision. I guess the fact that sometimes there aren't any answers for why things happen. Some people get healed. I mean, I believe that God is a healer, and that we can ask for healing in all cases. But some people don't get healing on this side of heaven, and that's just it's a hard reality. And I think that causes people to. Those are some things that we'll never be able to answer. Is why people get healed and some don't.
Did you ever have interactions with children?
Yes.
What was the
Not as much either. I was more sort of like with in more of an acute setting, but you definitely dealt with plenty of older folks, and sometimes some of them were just delightful, and they thought that they were just excited that they woke up the next day, and they were wonderful to deal with. And then you had the people that were in a lot of pain and constantly complaining about it. So you saw all sorts of people, no matter what. I think just creating the space to hear someone else's story, and to give them, to validate them, and to honor them by listening. And because I think people learn about themselves when they hear themselves tell their own story. So, in some cases, yes. I mean, largely yes, because in the hospital, most people don't choose to be there. And so most people are there for some sort of crisis or uncomfortable situation. And in the church or in campus ministry, you see people that are just, worried about their test and not so much about a major crisis.
Do you see a difference in terms of the expectations from you in like a campus ministry versus a hospital ministry?
The base of all of it, it's pretty similar. It's just I feel like the expectation is that I would be available to people, and that I would help people draw closer to the heart of God.
What were some of the aspects of your training? You mentioned you did in seminary.
Mm-hmm.
Like, what were the things they talked about in your trainings?
Self-awareness. So big part of being a chaplain and being in ministry in general, but really being a chaplain, they focus on this is this idea of self-awareness. So you did, painful self-awareness test and dialoguing with a peer group about, your challenges and your limitations in sort of a peer setting that was really refining and painful sometimes. But you get a much deeper sense of who you are and kind of where your strengths are and where your weaknesses are.
Why do you think that was?
It's very clear, because you deal with such grief and such tragedy and such difficult situations and high emotions, that the idea is you want to be aware of where your own trigger points are and where your own anger and insecurities and fears come from, so that you don't project them onto other people's crisis.
In the women's shelter, what was something you saw a lot of? Like, were these women mostly battered women, or they're women who just fell on hard times?
It was really both. It was really both.
Did you feel like the hospital setting, like working in that versus the hospital, did you feel like the hospital had more to offer in terms of recovery versus the shelter, or it was something where neither of them could really help?
Yeah, I think that was sort of the hard part, is neither of them could really they could only do so much. And so we saw a lot of, especially in the hospital, the community hospital, dealing with the homeless population, you saw a lot of recurrence, and you would just say they'd be there and then they get sent back out again. And so there was only so much you could do.
Did you see a lot?
Yeah, I worked in both. So I worked in the community hospital first, and then I worked for a year in like the really elite hospital. The difference is, wow. Interestingly, the main difference was that the community hospital treated their employees way better than the really prestigious hospital. So the community hospital was a much better place to work. As far as the patients go, the patients at the community hospital were way more eager and willing to talk about their pain and their suffering, whereas the prestigious, more sort of moneyed folks would, they were much more private and not so much interested in embracing suffering, even if they were suffering.